human cost of addiction was laid bare today with figures from Police Scotland showing that there were 1,065 suspected drug deaths in Scotland in 2024. A distressingly high figure, but one which is down 11% on the year before. Given that reduction, are there some grounds for optimism that this country is finally getting a grip of the crisis? The Holyrood government will certainly hope so.
The figures that we have seen today demonstrate that there is progress being made. The 11% reduction, the lowest quarterly figures that we have seen for this time period, is welcome, but it's a cautious welcome that I give because I recognise that for alcohol and drug-related deaths, they are still far too high, and for those family members who have lost a loved one, there will be no comfort in the fact that we're making progress. We need to make sure that we address this situation for the people of Scotland.
We reflected on today's figures with Kirsten Horsburgh, the Chief Executive of the Scottish Drugs Forum. Kirsten, what is your reaction to these figures?
So there has been a slight reduction in the suspected number of drug-related deaths prior to the following year, and actually maybe that's some indication that the measures that have been put in place are potentially working, but let's be absolutely clear, we are still in the midst very much in Scotland of a crisis in terms of drug deaths, and certainly there are lots of families who will be grieving, so this is not a moment for celebration, it's a moment to think about how we absolutely advocate for faster action.
You touched on that there, an 11% drop. What might be making a difference?
So the national mission was intended to really progress change. So they adopted a number of evidence-based strategies. So harm reduction measures like wider access to naloxone, better access to treatment. Obviously now we have the safer consumption facility, and then broader supports around the workforce and residential rehab, all of these things. But ultimately there is a gap in terms of what's being delivered on the ground. So we know what works, we know what we need to be doing, all of these things need upscaled. And now, not in months or years, because there is a risk there that the national mission really needs to introduce long and systemic change, otherwise there's a risk that it becomes meaningless. So we really need to double down on efforts. In
2020, when Nicola Sturgeon admitted that the Scottish Government had taken their eye off the ball, has there been more government focus since then, do you think? And is that helping?
So it was really welcome to have the introduction of a minister that was responsible for this portfolio of work, absolutely. And that's important because it recognised the importance of the issue. But, you know, there is an implementation gap. So policy without action is the issue. So, you know, we really need to implement a number of measures that are life-saving. And if we don't do that, it's unacceptable. And also it's at odds with a public health emergency response.
What sort of things are you talking about?
So there are safer injecting facilities, drug checking services, better access to a range of treatment choices, all of these things that need to be scaled up. These are all things that could be done. There's often discussions about what needs to change in a Westminster government to allow these things to happen, but actually, whilst that would make the road a little bit more easier and straightforward to do, there are loads of things that we could be doing right now that are within our powers.
You made the point there that this is welcome, but we're still in a very bad place. What is the situation at the moment?
Yeah, so this isn't just about statistics. This is real people, real families, real communities, and a huge amount of loss across the country. Scotland's rates are still the highest across Europe in terms of drug deaths, so we absolutely need to be advocating for more change, options that are supportive of people making improvements in their lives, their own quality of life, and options that meet people where they're at.
And what are the impacts on the families of these people who do die from drugs?
I mean, it's horrendous, particularly because these deaths are preventable. So any preventable death is a failure of policy and implementation.
We've heard a great deal, and there's been a lot of publicity about, and you mentioned it yourself, about the safe drug consumption rooms. it's too early, or is it too early for that to have fed through into figures like these?
Yeah, too early. I mean, the service has only been open since the middle of January, but already it's shown positive results in terms of the numbers of people that they are engaging with and the outcomes for those people, and just having a service there that meets the needs of people that a lot of other services don't. But one facility in Glasgow is not going to make an impact on drug deaths across Scotland, so it's important that we look at how we roll these out across the country. We don't need to be waiting for this pilot phase to be over before we start doing that, and certainly we also could expand the range of models of these types of facilities that are introduced as well.
Nonetheless, do you have any sense of optimism from these figures?
I mean, it's difficult to have optimism when there's over 1,000 people dying of accidental and preventable deaths. So this is still a major, major issue for Scotland. I mean, obviously it's much better than the numbers going up, but, you know, we need to be doing much more at a much faster pace to be really making an impact here.
Kirsten, thanks for joining us in Scotland Tonight.
Thank you.